Although it might seem easy to define mental health as the absence of mental illness, most experts agree that there is more to being mentally healthy. The U.S. Surgeon General has defined mental health as a state of successful performance of mental function, resulting in productive activities, fulfilling relationships with people, and the ability to adapt to change and to cope with adversity. The state of being mentally healthy is enviable given the advantages it affords. For example, mentally healthy adults tend to report the fewest health-related limitations of their routine activities, the fewest full or partially missed days of work, and the healthiest social functioning, for example, low helplessness, clear life goals, high resilience, and high levels of intimacy in their lives. Feelings or behaviors. Highly common, about 46% of Americans can expect to meet the formal diagnostic criteria for some form of anxiety, depressive, behavioral, thought, or substance abuse disorder during their lifetime. Some of the most common types of mental illness include anxiety, depressive, behavioral, and substance abuse disorders. Examples of anxiety disorder: phobias, panic disorder, generalized anxiety disorder, obsessive-compulsive disorder, social anxiety disorder. One frequently asked question about mental illness is if it is hereditary. Most mental disorders are not directly passed from one generation to another genetically, and there is no single cause for mental illness. Rather, it is the result of a complex group of genetic, psychological, and environmental factors. Genetically, it seems that more often than not, there seems to be a genetic predisposition to developing a mental illness. Everything from mood, behavioral, developmental, and thought disorders are thought to have a genetic risk for developing the condition. While everyone experiences sadness, anxiety, irritability, and moodiness at times, moods, thoughts, behaviors, or use of substances that interfere with the person's ability to function well physically, socially, at work, school, or home are characteristics of mental illness. Mental illness can have virtually any physical symptom associated with it, from insomnia, headaches, stomach upset to even paralysis. Socially, the person with a mental illness may avoid or have trouble making or keeping friends. Emotional problems can result in the person being unable to focus and therefore perform at work or school. What is the treatment for a mental health problem? Psychotherapies. Psychotherapy is the therapeutic treatment of mental illness provided by a trained mental health professional. Psychotherapy explores thoughts, feelings, and behaviors, and seeks to improve an individual's well-being. Psychotherapy paired with medication is the most effective way to promote recovery. Examples include cognitive behavioral therapy, exposure therapy, dialectical behavior therapy, etc. Medication does not outright cure mental illness. However, it may help with the management of symptoms. Medication paired with psychotherapy is the most effective way to promote recovery. Case management coordinates services for an individual with the help of a case manager. A case manager can help assess, plan, and implement a number of strategies to facilitate recovery. In a minority of cases, hospitalization may be necessary so that an individual can be closely monitored, accurately diagnosed, or have medications adjusted when his or her mental illness temporarily worsens. A support group is a group meeting where members guide each other towards the shared goal of recovery. Support groups are often comprised of non-professionals, but peers that have suffered from similar experiences. A self-help plan is a unique health plan where an individual addresses his or her condition by implementing strategies that promote wellness. Self-help plans may involve addressing wellness, recovery, triggers or warning signs,